Welcome to episode 7 in our series on polycystic ovarian syndrome. In this episode, I'm going to discuss the actual treatments of the various flavors of PCOS to maximize fertility. I'm not going to talk about cosmetics or anything else. I'm going to focus strictly on measures we can take to improve fertility. As I've stressed during this entire series, the treatment of PCOS depends on mimicking the environmental conditions for which this type of PCOS is suited. Different flavors of PCOS are more fertile under different environmental conditions. Treatment of PCOS always involves lowering insulin, and remember, blood insulin goes up in response to blood sugar, and blood sugar goes up in response to carbohydrates, which include sugars and starches and the like. Let's first discuss garden variety polycystic ovarian syndrome. This is the most common form of PCOS. Almost every woman with this type of PCO is overweight. It's not uncommon to walk around 40, 50, 60 pounds overweight. There's the rare woman who's normal weight, but most are overweight and have been struggling with their weight for some time. Women with garden variety do not need to lose huge amounts of weight. We generally see good fertility responses if a woman can lose approximately 10% of her body weight or more. The first step in losing weight in this situation is to cut out carbohydrates. Try to cut them out wherever one can. Bread, starches, sweets, that's usually sodas. That's generally the first place to start. A little bit of increased exercise is also helpful. Remember, exercise does not help you lose weight, but it increases insulin sensitivity, meaning blood sugars come down, insulin levels come down. Exercise also helps sleep. A lot of reasons to exercise. Now, you don't have to go to the gym every day or overdo it, but a little bit of exercise goes a long way. What has been understressed over time is that there are things, in addition to just calories or carbohydrates, that contribute to weight loss and well-being. Daytime sunlight with no glasses on at all, very, very important. We want to entrain the pineal gland, the pituitary, the adrenal glands to normal circadian rhythms. These are daily diurnal rhythms. Remember, PCOS women don't have their monthly rhythm. We want to help every rhythm in the brain to come back to normal, to maximize fertility potential. There is no data to say that you have to have 3 meals a day, 4 meals a day, 5 meals a day. I know of no evidence. If you can get away with 2 meals a day, even 1 meal a day, typically dinner, that's fine. There's nothing that says you have to have 3 meals a day. Whoever came up with breakfast as the most important meal of the day was brilliant, but they never had any data to support it. Now, we can add medication. Sometimes diet and a little bit of exercise are not enough to get ovulation kick-started. We can certainly help ovulation with a very common cheap medicine called metformin. Metformin comes in all kinds of extended release formulas and fancy types. You don't want that. You want the generic 500 milligram quick release metformin. Generally, if you take one of these tablets before a meal, whether that's once a day, twice a day, 3 times a day, that will keep insulin levels or excursions from going up and can have benefits on both weight loss and ovarian response and ovulation. There's a very intriguing product that revolves around the molecule Inositol. You'll see Inositol, D-chiroinositol, myo-inositol. This molecule is very exciting because on paper it appears to have many, many benefits that would appear to be beneficial for PCOS. In the early 2000s, there was a lot of excitement. In fact, there was a whole company started making pharmaceutical inositol products. That company is no longer. Why? Because these studies did not show much benefit. There wasn't the dramatic benefit that everybody anticipated. Now, of the various nutritional products, I'm not going to endorse any particular one. What I can tell you is if it's not exceedingly expensive and if you find it's working for you, the tablets, the powders, or whatnot, I see no reason why you cannot use it. But if it's frightfully expensive or you don't see any benefits, you certainly don't have to use inositol products. But certainly no reason you don't want to take them, or no reason to avoid them. In order to get dependable ovulation, we frequently turn to pills. We've been using a medicine called Clomid since 1968. Another drug called letrozole has become very popular recently. I know some programs really favor letrozole. We like them both, and I see no compelling reason why you need to start on Clomid or letrozole. Whatever works for you is the medication you should try. With Clomid, it's important to combine that with intrauterine inseminations. Letrozole probably as well. Sometimes low to medium dose of either of these drugs is all you need to ovulate and return fertility, or what I like to call subfertility. Because remember, women with PCOS are not infertile, they're more subfertile. Let's talk about the second flavor of PCOS, the athletic or lean woman with PCOS and irregular ovulation. This treatment is a little trickier because these women generally don't need to lose weight, and sometimes they need to actually gain a little bit of weight. I call this a brittle condition, something like brittle diabetes. The knife edge between being underweight and having low brain activity, and a little bit overweight and having too much pituitary activity, is a very fine line to walk. Remember, lean, athletic PCOS women like to run. They are natural athletes. As far as exercise regimens, they generally do better with a little more exercise. I highly encourage, however, lean PCO women not to be running marathons and these long distance cardiac type activities. Try to substitute more weightlifting and stretching, so we're not stressing the brain, yet we're getting the benefits of lowering insulin and mimicking this environmental condition for which they are adapted. Sometimes it's very difficult to get lean PCOS women to ovulate. Sometimes it's all or nothing. And sometimes we have to resort to IVF, so we can give the medications that cause ovulation, but generally make a very robust ovulation. Just this morning I did an egg retrieval on a woman with lean PCOS. We got 45 eggs from her, whereas when we were trying to get her to ovulate, it was all or nothing, very hard to control. So sometimes we have to resort to that if we're just going month after month and we're not getting the safe, dependable ovulation we would like. So that's where lean PCOS can be very tricky. The third form of PCOS, the severe PCOS, once again, in incredible genetics, adapted for times of extreme hardship, starvation, drought, wars, etc. And unfortunately, the treatment of PCOS women, the ones who tend to be very overweight, maybe they're already diabetic, apple-shaped or blocky framed or large framed, the treatment for severe PCOS generally has to be as severe as the condition is itself. Extreme, strict, dependable carbohydrate restriction is the first line of treatment. Now, this can be very hard to do. I understand this. And in conditions where women just can't seem to get the weight off, sometimes turning to bariatric surgery is helpful in these severe conditions, in these severe cases. There's some debate what is the best form of bariatric surgery. For women who desire pregnancy, we generally suggest they get what's called a sleeve procedure. In a sleeve, the stomach is made smaller, but the intestines are not rerouted. However, with the sleeve, we see a lot of failures. We see women who lose some weight and then gain it back. In those cases of severe PCOS, if we want a durable, dependable, significant weight loss, then a Roux-en-Y or a stomach bypass procedure may be the procedure of choice. Now, I know nobody wants to do this, but we got to do something because we need to get ovulation to occur, we need pregnancy to occur, and we need the pregnancy to continue and not miscarry and not be complicated by diabetes, high blood pressure, and all those other problems. So you need to be really strict with PCOS because it's very dense genetics that want to hold on to weight and maintain it for those times of shortcomings and times when there is not plenty. Now, women with severe PCOS, we can usually get them to ovulate. Generally need very high dose of medicine. A lot of people will tell you can only take 3 pills of Clomid a day. That's 150 milligrams. We routinely go up to 5 pills a day. And instead of giving it for just 5 days, we can give it for 9 days. We can add another medicine called dexamethasone. There's things we can do to get ovulation to occur. They're generally higher than the doses of Clomid used by generalists. We can use letrozole, and the same story applies. We can go higher doses of letrozole. Generally, people will only go to 7.5 milligrams. That's 3 letrozole tablets. We will go to 4 as well, and sometimes we'll get ovulation in women with severe PCOS. So there's your basic rundown of the fertility treatments for women with the different flavors of PCOS. I hope you found that helpful and useful.